Hello everyone and welcome to another case in the series of how to manage common encounters in emergency department. Today we will be talking about acute myocardial infarction, which is also known as MI, and heart attack in name terms. So let us start the case. An adult who presented with a chest pain. Remember, the patient who presented with chest pain can have life-threatening conditions like pneumothorax, like aortic dissection, like pulmonary embolism, MI. So you need to rule out. But here we are typically talking about MI. So the patient will be describing the chest pain like he has squeezing, pressure, or tightness. And the patient is shortness of breath. The pain is radiating to the left chest. The pain can also radiate towards the right chest also. So you don't need to think that if the patient have right chest pain and he could not have MI, he literally can have an MI. And pain radiating to the arm, shoulder, neck, jaw, till fingers, nausea, vomiting, sweating, and he's feeling dizzy. So you decided to do all the labs, but here and the test for the patient, but here you did ECG and you found that the patient has anterior wall MI or the inferior wall MI. The patient can have lateral wall MI2 and posterior wall MI2. And doing the labs you found that the troponins are right, but troponins take almost 3 to 6 hours to raise. So on the ECG you diagnosed him as MI. So your next step will be maintaining the airway, giving the patient oxygenation. It's very important for the patient. And then most important part we're talking about is in the circulation, that how you can save the patient. You need to give pass an IV cannula, monitor vitals. And here's the most important point which I want to teach you is if the patient systolic blood pressure is more than 90 mmHg and on ECG you didn't found an inferior wall MI and the leads 2-3 and AVF, you can safely use the tablet glycerol trinitrate 0.5 mg one tablet sublingually. But if you found an inferior wall MI or the systolic blood pressure is less than 90 mmHg, you cannot give the patient GTN, as because the patient is having right ventricular infarction, which will be presenting with hypotension, right GVP will be raised and clear lung fields. So if the patient have right ventricular infarction and he developed hypertension and then you give GTN, you can severely lower their BP and it could lead to an ischemia in the brain. So remember this point, it's very important when to use and when not to use. In another, you can safely use morphine 2 to 5 mg IV stat. It's also for the decreasing the afterload too. Tablet aspirin, antiplatelet therapy, aspirin and clopidogrel 300 mg per oral stat, an injection and nexaparin or heparin. So depending on the patient's condition, if the patient have CKD, you have to use heparin. If the patient have no CKD, you can safely use an nexaparin for anticoagulation. So you can remember the mnemonic for the managing MI is simple by Monabash. Acutely you give morphine, oxygen, nitrates, aspirin and heparin, beta blocker for increased heart rate, decrease mortality, and statin also decrease mortality, and ACI also decrease mortality. So remember the management. Mostly the ACI and statin will be given once the patient is being monitored in the ward, and heparin can be acutely given. So remember this mnemonic, Monabash. So I want to talk about some few points, which is not going to much details, just trying to tell you that what do it mean by door to needle time and door to balloon time. Door to needle time means the patient had an ST elevation MI and he presented to the hospital in less than 30 minutes. So then we recommend the patient can have TPA, like the thrombolysis. If the institution doesn't have PCI, then thrombolysis can be given. If the institution has a PCI setup, the PCI is preferable more than TPA. And as I told you, door to needle time is the time between a patient arrival at the hospital and when thrombolytic therapy is initiated. And door to balloon time means for PCI stent is 90 minutes. Door to balloon time is the time between a patient with ST elevation MI arriving in the emergency room and when balloon is inflated in the coronary artery. So the guidelines recommend that D2B is between 90 minutes or less for patient undergoing PCI, primary percutaneous coronary intervention. So I'm not going to much more details, but you need to, whenever you face such a patient, you need to decide to manage this patient, and then you need to the cardiologist to take further actions. Thank you for watching. I hope you have learned certain how to manage a patient with MI in ER. Please like and subscribe my channel, and see you in another case. Thank you.